I said at the very start of all this that whatever interventions we're going to make with COVID-19, we are going to have to look at the costs of those interventions as well as whatever benefits we'll be getting from it, from preventing the spread of COVID-19. How many illnesses and deaths will that stop? Versus how much misery you'll create by shutting down businesses and putting people out of jobs and things like that. Also, I've talked about things like seasonal depression. A lot of more people are getting that because they're not able to go out. I've mentioned the light therapy lamps, that seem to be good. I got one of those. And I'm not one who ever got seasonal affective disorder. And I'm in North Carolina and I'm out in kind of the boonies. And so we've had a few sunny days where I can at least go out in the backyard and enjoy the sun. But all these rainy days we've had and all the staying inside and having to wear masks when you go out, you don't really feel like you're truly outside when you're wearing a mask. You feel, almost like you're, in a spacesuit or you're Darth Vader or something. So I got one of those lamps and, oh man, 20 minutes a day of having that thing on just makes the difference. So whatever's happening with you, I hope you're staying safe. I hope you're staying healthy, physically and mentally. So that brings us to this story. It's kind of a follow-up to the last one about the CDC study with COVID-19 from the same writer, Jacob Sullum, on Reason. And he asks, were the COVID-19 lockdowns worth the cost? The evidence suggests Americans are right to wonder. Unfortunately, you won't hear any of this in the regular news media. You dare to question the lockdowns. Oh, you want to kill grandma. I've gotten that one. Yeah. I've blocked people for saying that. No, I'm not going to put up with that crap. No. So he asks, did the lockdowns fail because they were imposed too late and lifted too soon? Or did they fail because they were fundamentally misconceived? On that question, there's much disagreement. And that's the thing we keep seeing. Whatever the policy is, if it fails, there's always some excuse that they didn't say beforehand. They say, oh, we need to lock down right now. They don't say, well, we're kind of doing this a bit too late. They don't say that beforehand. No matter what you do, no matter what policy you put in place, either things are going to get better, they'll stay the same, or they'll get worse, regardless of what effect your policy has. So this is Morton's Fork. If it gets better, you go, yay for our policy. Even if you don't have any evidence your policy had anything to do with that. If it stays the same, you say, well, we corrected the problem. Things didn't get worse. And if it does get worse, you just say, well, think of how worse things would be if we didn't do it. It'd be a lot more worse than that. They said that crap about, the stimulus back after the financial recession and the financial crisis. They spent, all that money on stimulus and it didn't work. I said, well, that's because we didn't spend enough. Yeah, there's always some reason after the fact. Always some reason. That's why you need to specify your predictions beforehand. Or you're not doing science. You're just not. So he says, those orders, which entailed enormous economic and social costs, were clearly unsustainable over the long term. And once they were lifted, we are bound to face the challenge that confronts us now. How to deal with a virus that poses a negligible risk to most of the population, but a serious risk to many people with pre-existing medical conditions. A virus that people often carry without realizing it because it can be transmitted before symptoms appear, when symptoms are so mild they cause little concern, or when symptoms never show up at all. And again, when you're doing lockdowns, you're just holding the pause button on that. So, what's the point? Well, he says lockdown advocates understood that the virus would still be with us after the restrictions were removed. But they argued that lockdowns would prevent local health systems from being overwhelmed by COVID-19 patients, which would endanger not only their lives, but the lives of people with other illnesses. That was a scary prospect, although it was probably exaggerated even in places that were hit especially hard by the epidemic. New York City, for example, ended up with more ventilators and hospital capacity than it actually needed. And another reason they gave is that the restrictions would buy time for treatments to get made. And we're starting to see the first of those. They just approved a steroid that would help with the inflammation. That is a big threat to the COVID-19 patients. Again, it's not the virus that kills you, it's your immune system overreacting to it. One of the things the immune system does is create inflammation to fight off the virus, but if it creates too much inflammation, then you can't breathe and you die. So, and they're looking at some others, but this is, again, we have an obstructionist healthcare system. That's all government ever is with healthcare. It's obstructionist. So it's just taking far more time. Check out my video on this. We might have had broad spectrum antivirals right now if it weren't for ridiculous FDA restrictions. And the other reason is they need to buy time to develop the testing capacity required to identify carriers. Well, considering they've had home tests for months and the CDC wouldn't let them. He says even states that were relatively well prepared on that score are doing a pretty pitiful job of testing and tracing, a mission that seems daunting given the enormous gap between total infections and confirmed cases. And that's exactly what I covered in the last video, another recent article about the CDC findings. He says all of these arguments assumed that lockdowns would have enough of an impact on virus transmissions to justify the huge burdens they imposed, but it is by no means clear that they did. Cell phone data show that Americans were already moving around less before they were legally required to do so. So again, this is government jumping in front of a parade and pretending to lead it. And he says it's possible that lockdowns accelerated the downward trends in mobility and delayed or attenuated the upward trends, but the data suggests that the trends were driven mostly by voluntary changes in behavior. In states with broad business closure orders, many people were not going to work, and no one was allowed to go inside bars or restaurants for drinks or food. It seems reasonable to expect that such restrictions would reduce virus transmission to at least some extent. Yet, in Texas, where a statewide lockdown was imposed on April 1st, that order had no obvious impact on the number of new COVID-19 cases reported each day. And after the stay-at-home order expired on April 30th and businesses began to reopen, more than a month went by before there was an explosion in cases, even though the median incubation period for COVID-19 is 4 or 5 days. And that mirrors what we see all over the country and all over the world. There's just no correlation between imposing the lockdown and lifting it and whether or not these numbers get better or worse. They don't have anything. It says a longer view shows that newly identified cases had risen dramatically since late May, from 589 on May 26th to more than 2,500 on June 10th, a fourfold increase. That increase may have had something to do with gatherings on Memorial Day weekend and the mass protests against police brutality that followed soon after. Oh, how dare you! Don't you know that the virus is anti-racism and doesn't affect BLM protesters? Yeah. The news media is weird. Reason is consistent. That's one reason I like them. I don't agree with everything they put out, but at least they're consistent. I think they should be a model for a lot of the others to follow. They'd be better at any rate. But he asks an interesting question. He says, doesn't that imply that letting restaurants operate at 50% of capacity, the limit to which Abbott reverted, rather than 75%, is consistent with keeping the epidemic under control? And doesn't that imply that the original order, which prohibited all restaurant dining, went farther than necessary? And he does an attempt to answer. He comes out and says he doesn't know the answers, but he says, Texas, according to lockdown supporters, did pretty much everything wrong. It closed businesses too late, allowed them to reopen too soon, and failed to develop testing and tracing capacity enough to make a real difference. But what about California, which led the nation in ordering businesses to close and telling people to stay home, and has been only gradually lifting those restrictions? Newly confirmed cases are also rising dramatically there, from 2108 on June 15th to 7149 on June 23rd, a more than threefold increase, similar to what Texas saw during the same period, although that number had dropped to 4810 as of June 27th. It's hard to put much stock in the argument that Texas has been exceptionally reckless when even a super cautious state like California is seeing similar increases in newly identified infections. Yep, we're seeing pretty much exactly the same there. California's reproduction number was 1.71 in early February. It was falling significantly before the lockdown, and then it settled on 1, which just means it's a sustained epidemic. The number started rising in mid-May and now stands at 1.09. In Texas, by contrast, the decline happened almost entirely before the statewide lockdown, and the number began rising before the lockdown was lifted. The estimate is 1.08 today, slightly lower than California's number. If California was more successful at reducing virus transmission because it imposed a lockdown earlier and began to lift it later and more carefully, that success is not reflected in these estimates. Back when I was a teenager, Wendy's had this commercial. Actually, there's a series of commercials in which people asked a very simple question. Where's the beef? The idea was you go to another burger store and there's all the pickles and lettuce and everything. Where's the beef? You look under there. Oh, well, finally I see the beef. It's a small patty under there. And Wendy's, of course, has these nice big square patties, so you don't have to ask where's the beef. You see it. So where's the beef became a saying for my generation. It means where's the substance behind what you say? Where's the actual meat of it? Where's everything that backs you up and shows you to be right? And so that's what I'm asking with all these lockdown proponents. You say it was necessary and you say it was working and you've got all these reasons why things didn't turn out, the way you wanted to do. Well, where's the beef? Where's the evidence showing that the lockdowns were a good thing? So the evidence suggests that Americans initially changed their behavior in striking ways, then recalibrated their reaction as it became clear that we'd be living with this virus for a long time. Many people, especially those whose own risk of dying from COVID-19 is very low, probably would have become increasingly impatient with pandemic-inspired limits on their lives, even if politicians had never deprived them of their livelihoods and ordered them to stay home. But the bitter experience with sweeping and frequently arbitrary government-imposed restrictions seems to have left many Americans less willing to take even relatively modest precautions. Yeah, it's pushback. Pushback happens. And he quotes Vanderbilt University infectious disease specialist William Schaffner. There was real hubris on the part of public health officials at the start. The United States could lock down and contain the virus as China had, and that futile hope helped create an unrealistic expectation that the shutdown, while intense, would not be for long, and that when it was lifted, life would return to normal. And Solomon says, now that we have emerged from lockdowns with no real confidence that they actually reduced the death toll, many people are understandably asking what the point was. And he's quoting the New York Times here. Many Americans started in the pandemic with a strong feeling of solidarity, not unlike the days after September 11. They closed their businesses, stayed inside, made masks, and wiped down their groceries. In a country often riven by politics, I'm not sure if that's a typo and it's supposed to be driven, but polls showed broad agreement that shutting down was the right thing to do. But months of mixed messages have left many exhausted and wondering how much of what they did was worth it. And Solomon says they are right to wonder, and I absolutely agree. There have not been anywhere near enough people asking this question, especially in the press. The press is going, yay, lockdowns, yay, government, right or wrong. Our high priests have said these lockdowns are good, so that's what it's all about, I guess. Not about giving you information, not about, being skeptical and actually researching and doing investigative journalism, not about comforting the afflicted and afflicting the comfortable. Nope. It's just about being a mouthpiece for whatever government says, especially if it's the side of the government that we like. We like the Andrew Cuomo side. We don't like the Donald Trump side. Yeah, it's crazy. Yeah. So thank you for watching another one. Please let me know if you like this format. I'm doing this mostly because I'm on vacation right now and I'm just trying to queue up a bunch of videos to place on my channel, still have content. But if you like this, and I think I'm kind of getting good at this kind of presentation, then please let me know in the comments. I will go back to doing the Lord Killian videos and all my regular stuff. The podcast will resume. But if you like these videos too, I might add them into the mix. So just let me know. Either way, hit like, subscribe, and the bell. Share this video everywhere to help compensate for shadow banning. Please donate whatever you can at donate.bogosity.tv, even if it's just a few pennies in crypto. Or become a regular subscriber at Patreon or Subscribestar. Get all the videos early and ad-free. Thank you so much for watching. Until next time, stay strong and be free.